Welcome to the Critical Care Obstetrics podcast. I'm Dr. Stephanie Martin, and the gang's all here today. I've got Julie Arafay, our simulation director at Clinical Concepts, and Suzanne McMurtry-Baird, our nursing director at Clinical Concepts. Should I call you McMurdy Baird? Because that's what everybody calls you whenever you get introduced.
I swear, I know. It's been a problem all my life.
McMurdy
Either that
Baird.
or they call me
don't
by
these
my
people
first
watch
name,
Lonesome
which
Dove?
is not Suzanne.
I mean,
I know.
yes.
Or read Larry McMurtry's books. Yeah, I know.
He's one of my favorite authors, and I remember very distinctly when one of the first times we got introduced, and I was like, any relation? And I was a little fan, awestruck, like fangirling a little bit, like, oh my God, Larry McMurtry, because I love everything he's written. Anyway.
Technically, I'm sure we are back, farther than I've traced back, but he's not a cousin or anything. But we like to claim him, and
listen, claim him completely.
Yeah. Why not? Somewhere.
Some good Southern roots.
I know, right? Too. And Texas, I lived there 3 times. So.
And when I say the gang's all here, I mean the gang's all here. So for you on video, I'm going to move my camera and show you. Here's our other member of the podcast right here, Peanut Butter.
Yeah.
He's curled up. He was on the desk next to me, and he's gotten in a much more comfortable position now because I think the desk is a little too hard for
wasn't
his...
he laying like on your keyboard?
Yes, he was literally like right up against, and he's enormous, guys. Okay. I can tell you exactly how much he weighs. 17.7 pounds, and it's not fur. This week, I've got him on a diet. Like I've backed off on the amount of food I'm feeding him, like less. I'm really trying to get my cat not to get diabetes.
Yeah.
And to protect his joints. I'm trying to be a good cat mommy. And he doesn't like it one bit. And it's been a few weeks like this. And I told my husband yesterday, I'm like, he looks like he's losing weight. I'm pretty convinced he's losing weight. I get on the scale. I put him on the scale with me. He's gained half a pound.
Yeah.
Oh, no.
Just like, oh my God.
It's water weight.
I mean, I died laughing when he's like, yeah, sure, he's lost weight. Anyway, it's hopeless.
I know. Well, I don't know. I was a free feeder. I still am for my cat.
Mm-hmm.
So, yeah, y'all don't know I have a cat. Her name's Maggie. And the only reason she's Maggie is that was my mother's middle name. And so, or it was her first name. And she always named her black cats Blackie. We had like Blackie 1, 2, 3, 4, 5, 6, 7, 8, whatever. And instead of we adopted this cat when we lived in Houston. And Mark said, "Where are you going?" I said, "I'm going to PetSmart." And he goes, "Do not come back with another cat." And we did. And she was black. And we were like, "What are we going to name her?" I said, "Well, we're not naming her Blackie." And we named her Maggie instead after my mom.
That's good.
That's funny. Well, Peanut Butter was not my mother's maiden name.
I know.
He came named from the shelter.
I know.
I volunteer at a shelter, and it's at the PetSmart. I'm the one who goes back and changes their litter and feeds them and loves on them and socializes them and all that kind of stuff. And I absolutely love doing it. And that's where I met him. And I was like, yep, he's mine.
Now that can't be one of your fun facts.
Yeah.
Oh,
Yeah.
well, we'll see
Or
if
your
anybody remembers.
truth.
Yeah, Julie, we were at A1 last week. You couldn't be there because you were ill, and we're going to talk about all of this coming up. We're going to talk about the recent healthcare experiences in our world and our nightmares. But we were there, and so we started lately doing 2 truths and a lie. And to see what the audience can figure out about us. And so we did this at A1, but Suzanne cracked us up because she could not think of a lie. Like, she kept thinking of all the truths. And so we're at dinner the night before, and she's like, well, I can't think of another, lie. I guess I'm just going to have to make something up. And we're like, that's exactly what it is.
I know. And then I got up there totally messed it up. I was like, what's my lie?
She got up in front of the audience and told them 3 truths.
I can't lie.
This is a good
Stephanie had
trait.
to coach me through it in front of everybody. Everybody was dying. I was like, I just can't lie. I can't lie, I guess. Oh.
So if you ever come see us speak in person, we may give away hints on the podcast as what our truths and our lies are. So,
Yeah, I think it
but
is
it is hard
too.
to come up with a lie about yourself, I think.
Yeah,
But it's
mine
always
was
a little
not
fun.
good enough, and I was trying to come up with something better to lie about, and I couldn't do it. So anyway.
Well, a couple things. First of all, if you guys like listening to us, you might like watching us on YouTube. Also find us on Patreon. We got lots more stuff on Patreon, patreon.com/CCOB. You can join us there. We do live stuff there. We do lots more deep dive education stuff. But patreon.com/CCOB and all of our other socials. Let us know what you guys want to hear, what you like, ask us questions, all the things. Today, we're going to talk about why Julie wasn't at A1, and not everything was giggles and fun at A1 for us, although it was great. It just didn't end the way we wanted it to end. And for those of you who don't know, A1 is the Association for Women's Health, Obstetric and Neonatal Nurses. They had their annual meeting, convention, conference, whatever you want to call it, in Orlando, Florida in June.
It's good that it wasn't as hot this year.
And we were presenting there, and we always have a great time. I love nursing conferences. They're way more fun than physician conferences in my experience. And but we went out with a bang, Suzanne. So
yeah.
I'll start.
Who's gonna go first?
Well, Julie, yours started first, so why don't you
Yeah.
talk with yours? So we've had unfortunately, CCOB has had some recent encounters with the healthcare system in the role of patient/consumer. So, and it's been incredibly frustrating. And so we saw opportunities to kind of highlight those experiences and talk about what the experiences were, but also maybe what we can do better.
Well, I was in
real
a
strategies to
large
make it better.
metropolitan area, not my own, not close to my own, and developed severe gallbladder attack. Ended up in the emergency room. I am on an anticoagulant for previous DVTs. And so as I went in, it was severe enough that they thought I'm going to have surgery pretty quickly. I had actually, one of the ducts was completely obliterated by a stone. So I go into only what I would call a MASH unit.
But didn't you have a colleague in the area that you contacted to even get instruction? Like, where do you think I should go? Like, which ED do you recommend? Because you're out of your element. You don't know where to go. So you have an advantage even in that way, right? You knew where to go, and even that didn't sweeten the pot.
I think I got really great care because I was in so much pain that I walked through the lobby of the hotel and the emergency room in my pajamas. My husband was horrified. He's trying to cover me up. And I'm like, I don't care. I am in pain. And the poor little guy who was the security officer leaves his post, runs and gets me a wheelchair. I must have looked horrible. And they fast track me right in. And I must say, within probably actually 20 minutes, I had an IV. I had been assessed. I had morphine on board, and I had a bedside ultrasound that confirmed the diagnosis. I had blood drawn. I mean, that was all within 20 minutes. So I'm thinking, wow, this is great. Then there are no beds for people like me. I mean, obviously they can't send me home. They're thinking I'm going to be going to surgery. I have to get this oral anticoagulant out of my system. So I go into a holding area that I can't describe other than a MASH unit. Even there, the care was good. I got all my meds when I was supposed to get them. I got pain medication when I needed it. But I was in a room that is a typical emergency room with 70 some odd other people. We were in stretchers, cots. I mean, you know, they're not super comfortable, but they're not uncomfortable. with no dividers. I was lined up right next to the nurses station with about 10 other people. So no privacy. No,
Wait,
there
no
were 3
dividers, no
rows of
privacy?
patients around the nurses station. And I didn't need a call bell because the nurses station was just over the wall. That's where the nurses were sitting. I mean, I could have reached over and probably asked, not really because I had IVs in both arms, but yeah, I could yell and someone in the nurses station would hear me because they were just over a half wall. So I'm in one line up against the nurses station. There's another line of patients outside of what would be your typical emergency room bays, and there were people in the bays. So there were literally people squeezing through, 2 people on carts to get to the people on stretchers to get to the people in the bays. It was crazy. There were and my husband said there was another room like that. So there were probably at least 60 to 70 people in the area I was. I saw maybe 2 or 3 nurses. And there were emergency room physicians. They were
Oh my
residents.
gosh.
They were all very good, but I don't know that I could have functioned in that much chaos. It was utter chaos. There was a woman down the stretcher retching. There was a guy behind me who was a little bit confused, begging for water. And, they did go and talk to him, but I mean, it had to be lit. So there was lights on all the time. I was there for almost 48 hours, almost. And then I got moved to another bay with
Whoa.
people who are in line for either surgery or a room. And I stayed there for about 24 hours. And then as people got rooms, I got moved into a bay that had a curtain that closed, and I had a call bell and, some privacy. And I finally slept.
And now this to
Yes.
for the listeners, obviously we were texting with Julie this
Yeah.
whole time, what the heck?
I was in Europe.
Yes, and the reason you were waiting from
Yes.
the best you could tell was because there was no
No.
room at the inn. It wasn't because of your specific
Yeah.
clinical situation. It was because they didn't have
Right. No
anywhere else to
beds.
put you
No
but
beds.
like this step down emergency department.
It's a level 1 trauma center.
Wow.
Surgery must have
So
been full
I
too
was due to
because
go into surgery like the beginning of the 3rd day because I had my 2-day, no oral anti. I was on a heparin drip, so I couldn't go home or to the hotel. I mean, I needed to be in the hospital because they were checking heparin levels, making sure I stayed anticoagulated. So the morning I was supposed to go into surgery, my husband walks in and goes, "Why are you still on heparin if you're going to surgery in 4 hours?" Of course, by then it had been delayed. They're like, "Well, you're going to go this afternoon." Oh, well, then, no, well, we're going to get you first thing in the morning. And Stephanie and Suzanne are like, "No, no, 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 no. You're stable enough. Get the heck out of there and go home." And, that's what my husband wanted to do too. And I mean, I can't say they were so kind. And I felt so incredibly sorry for the nurses. I mean, I did see some shortcuts. I don't know that I would have done
Mm.
anything any different. And, I thought to myself, because I have a family member who's stage 4 cancer. And that person has told me, "I will never, ever go back to the emergency room. Don't ever, ever take me there." And I thought, okay, this is why. And, if you have patients that don't want to go to the emergency
Yeah.
room, I can understand why. This is really a problem. And as I got back
Mhm.
to my hometown and I was talking to the surgeon who eventually um, did my cholecystectomy, which is why I wasn't at A1, I was post-op. Um, they basically told me it's really a problem in almost every metropolitan area that there are not enough beds. everybody is flooding the emergency room. And he said, even in our town, which is a mid-size kind of town, he said it can get that way. It's not that way all the time, but it can get that way. I was in that emergency room for almost 4 days, and it never changed. The chaos, the noise, the number of patients never changed. I asked one of the nurses, I said, "How do you do this?" And she said, "It is so hard." She said, "Every day when we come in," she said, "it's utter chaos." And I guess they rotate through trauma bay and because I wasn't in the trauma bay at all. I was in a holding area. She said, we can't work in this
Mm-hmm.
holding area for too many days in a row because it's just so chaotic that, yeah,
Well, this is why I can't watch The Pit. It's because it's just like this idea
yeah,
that because it's too real, the trauma, the stress, the drama, the anxiety, and these nurses, like
yes,
the things that they put up with. These are highly trained, highly educated, very
yeah,
smart, hardworking people. They put up with abuse, threats, poor pay, awful hours, and they just keep coming back. It's I mean, thank God for them, but I don't know how they do it. And that is what influenced we'll talk about Suzanne's situation later, but when we were making a decision, ED versus urgent care, and I'm like, we got to keep Suzanne out of an
Oh,
ED.
all because of you, Julie. Well,
but
I
Julie,
can't imagine.
as a patient, like how do you think you had more empathy for the nurses because you are a nurse, or how challenging is that as a
I
patient
mean,
to feel
yes.
badly for the
I
people
mean,
taking care of you? When
and
you're
okay,
sick,
this is the
you're not
final
well.
thing. I told you there's no privacy. For all those people, there were 2 bathrooms. 2 bathrooms.
Mm,
And I mean, they worked
that's worse than a
constantly.
gas
The
station.
staff were in there constantly replacing
Oof.
supplies and cleaning, but these people are sick. I mean, I wasn't feeling my best either, but I was, once my pain was relieved, I felt so much better. But I mean, you could just see people. I mean, I was an EMT before I was an RN. So I worked in the emergency room as an EMT, never on an ambulance. So I have kind of a sense of how chaotic the ED can get. And I had sympathy, I think, because I was a nurse. Most of the people that I looked at as I made my way up to the bathroom and back were just shell shocked. You have no privacy. There is full lights in your eyes all the time. They did give you a little kit that had eye blinders, and a lot of people had those on. But unless you had earplugs, the noise, the light, the chaos, other people in distress, and I have to say they addressed it as soon and as quickly as I think is possible. But people just look shell shocked. I mean, I felt like I was in a MASH unit. That's what I felt like. I felt
Like I feel anxious you're doing such a great job describing this. Like I feel anxious just listening to you, like,
Terrible.
and
I mean, I
hoping that I
I don't
never
think I
have to
could
go
work there
end up
as
in
a
an
nurse.
emergency
I really
department.
don't. And I told them, I said, "My gosh, how do you do this?" And she said, "Well, the turnover rate is incredibly high." And, I also started to think because there were residents everywhere. Because at this particular place, the minute they draw your blood, you get a notification saying your blood is in the lab. Someone will come and talk to you about your results within this amount of time. They always met that. I always had someone coming saying, "Hey, we drew your labs. This is what we
Wow.
found. This is what we're going to do." And that was mainly residents. And I thought, so they think this is normal. They don't what else do they know?
Well, but not only that, but it also tells me that they have put systems in place. They're
Yeah.
using technology to help
Yes.
manage some of the chaos because I mean that's phenomenal.
Yes.
Like that you are getting that kind of communication.
Yeah.
And that you know that the communication is going to come. You don't have to be asking, or you can let that go. And that it did. And as a provider, I'm thinking as a physician, if I know I'm going to get an electronic notification that this task is ready to be done.
Yeah.
I mean, that's huge. I don't have to go in.
Well,
Are their
and
labs back? Are they ready?
yeah,
Are they
and I
whatever? What a
had
great
access. Like I got
Yeah,
thing.
that
a
is good.
CT scan with contrast. I had access to my ultrasound scan. I had access to everything through my portal. So that was helpful as well. And if I didn't know how to
Mhm.
do the portal, there was somebody that came around and made sure that I had it set up because I'm not the most savvy of people with technology, and I know there are people who are a lot less savvy, but they had support people there to help you if you were having difficulty dealing with the technology on your phone.
Well, I immediately think of my mom,
Yes.
who is in her late 80s, and I'm her IT support. God bless her. And um, she has been in ED several times, and there's under no first of all, she won't have a smartphone, and under no circumstances will she thinks she's very highly suspicious of these portals, right? And so, like, she called me the other day to tell me that my email was broken. And I said, "What are you talking about?" And she says, "Well, I can't send you an email. Your email is broken." I'm like, "That's not my email. Shall we work through your email system here?" So I think about the patients who really are, and that's a large part of our population, and our population's aging. And so, yeah, but the majority of people are going to have some access and the portability. So for you, because now you're leaving that ED, you're going to go to another state. Now you've got
Yeah.
access to all your stuff. Same for you, Suzanne.
Everything.
So your new doc, so you don't have to have another
Of
CT.
course. And
Because the docs
everything
don't want to read the
before
report.
I
They want to
left
see the
and
images.
came back to my home city, everything was transferred into the record to my healthcare system at home. They had access to every single thing that happened to me. It really facilitated my care once
That's
I
great.
got home because
That's
within
great.
48 hours, I had consulted a surgeon and had a date the next, I guess within 72 hours, I had my surgery. Me too. It was so much easier. And of
I'm
course, in
so
the
glad
midst
you
of all
got
this, we're
home.
remodeling our house. So we weren't able to come home. So I went to my favorite little hotel in the town we're in. Yeah, it was a great.
You had to
My
give
husband
yourself
said,
something,
"We
some
are
kind of
staying in a nice place. You are not coming post-op to a place that's marginal." So we stayed in a very luxurious hotel. Oh, it's so nice.
I know the
Oh,
hotel.
it is.
I used to live next to it. I love it's it's a
Well,
gorgeous
yeah.
place.
I
It's
mean,
so
I'm
comfortable
home
You
and
to
probably didn't wanna go
chaos, but
home.
at least it was home. Oh gosh.
Yeah.
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 Well, and I was worried about you for all the obvious
Mhm.
reasons, but also
Mhm.
because, as you just said, you have a history of DVTs, you're
Yeah.
on blood thinners, and I'm thinking emergency
Uh-huh.
surgery,
Uh-huh.
traveling on a
Uh-huh.
plane back home to altitude. And
Yeah.
if you guys aren't screaming
Oh,
blood
yeah.
clot,
Oh,
then
yeah.
then you need to rethink your risk factors.
Yeah.
I mean, so I'm really, really glad that you were got stabilized. In some ways, I mean, I don't wish the long stay,
Yeah.
but in some ways, the
It did.
observation period allowed you to come home and have your surgery to be done at home,
Yes.
and your
Yes. In
recovery
a
near home
hotel.
instead of um, out of state.
Yeah. I That's what my thought was because I got, gallstones in pregnancy, my first pregnancy, and, immediately I had a bunch of people on me, like, pressing to see if I was, because I had right upper quadrant pain. So they were making sure it wasn't preeclampsia and I didn't have, you know, HELP syndrome and everything, and I'm like, "I am not hypertensive. I have something else going on," and they ultrasound me and they're like, "Hey, you got gallstones." So anyway, I had just eaten, like, really cheesy pizza or whatever, so, I mean,
Did
wham,
you
I
have it
get
out while you were pregnant?
no,
Okay,
no,
good.
so I
They were able to
knew that
postpone.
if, you had a
Mhm.
blocked duct and that's what causes that colicky pain, with, the gallstones, but it is really difficult to if you are pregnant to differentiate it first until you get some labs back, till you get an ultrasound done, because guess what? Same area,
Yes.
and your pressure may be up because you're in so much pain. But, it was,
Yeah.
I just thought about your situation, I was like, "Just go home."
Yeah.
get off that heparin and go home. Since you're not in pain anymore, it probably means that stone has kinda traveled down a little bit and you're not in current acute
Yeah.
pain. Go
And
home
be
and do it
pre-op
there
without
and be more
having to fly,
comfortable.
or post-op without having to fly.
Yeah.
And these,
Right.
these ED I mean, we're not ED staff.
Right.
We speak from general knowledge, not from intimate knowledge. But I can't imagine that this situation is going to get better. And because hospitals are closing, access to healthcare is challenging for many people, and the ED becomes both true emergency and primary care access. It's where people go for everything and anything, and it just sucks up resources when it doesn't need to. So it's a bigger problem than just having a bigger emergency department and hiring more nurses, although those are essential
Well, there's
pieces.
gotta be a fix to the forward flow of patients, and I think
Mhm.
Yeah.
we've seen that a lot in OB triage areas or OB-EDs as well, that if you stuff those areas full of other things that don't need to be there possibly, but if you have an OB-ED, everybody's coming to you, but you've gotta have some kind of system where it's forward flow, right? You're triaging, you're making sure that you're treating the most acute things that need to be treated, the highest priority, and then you've got to have that forward flow. So it may mean that you need to have a pop off of certain things. And the use of advanced practice nurses.
Mhm.
And I know, Julie, your situation, you had residents there that could facilitate some of that. But if you don't have any beds in the hospital and this patient needs to be admitted for A, B, or C, you've got to be able to have that pop-off area or
Yeah.
something to be able to get those patients in and out.
Well, in
Yeah.
your situation, even as simple as reassessing the situation.
Yeah.
Yeah.
Like, you had an initial plan of care, but your condition evolved and changed, and
Mhm.
that allowed for an opportunity to reassess the plan of care. It's almost like they got tunnel vision that this must happen,
Yeah.
and you were the one that brought up, "Can we
Yeah.
revisit the
Yeah.
plan of
I mean,
care?"
they were
And then it
they
seemed
were
like they
like,
were like, "Yeah, of
absolutely.
course."
When I had been, I don't know if I spoke or texted with both
Yeah.
of you. I know texted with Suzanne, but when I approached them, and of course my husband was like, I want to do this at home. I really don't want to do this here, because how long post-op, and then where do we go, and how do we, we're staying in a hotel now, and it's just going to be so much easier at home.
Mhm.
But when I approached them with a change in plan, they were like, "Oh, that's fine. We totally understand." Yes. And I think it's just because they're so busy. I mean, I'm one of, if there were actually 2 of those
Yes.
rooms, this is like a mini med surge unit. It's like a full med surge unit because, well, yeah, well, maybe 3.
With
Mhm.
2
But
nurses.
I mean, yay.
Well, still. Oh, good. I
But
get
I don't know
10.
what was
I get
happening on the
20
other side,
patients
because
now
the
instead
3
of 30.
nurses that I saw were only on my side, and I saw them because there was no place for them to hide. I mean, you could see the whole unit basically. Yeah. Yeah.
It sounds like they're staffing
Yeah.
by square footage and not
Yeah.
by patients.
I mean,
There are no
that brings
staffing
up a whole
standards.
thing. I mean, like,
2
what
nurses
what
per 800
standards are
square
there
feet.
out there for these holding areas? I mean, is there any criteria? How long do they stay? I mean, and how do you meet any kind of criteria they would develop if there are no rooms?
Well, and I can just see it, and if it was like OB like that, we'd be
Kidding.
like, "You must be on continuous fetal monitoring, even though you have a reactive
Yeah.
NST or whatever," I'd be like, that'd be the first to go. But the charge nurses in those units too, they're not just managing those 60 patients in that one bay and then another room that's identical. They're managing probably the
Have no
entire
idea.
ED.
I
And
wonder if they had more than one
I have
charge.
no idea.
Probably not if they
I
were
have no idea
understaffed
how
just
it
in
went.
general, but
oh,
I have
Lord.
no idea. I
I wonder how many
know I know
physicians
I
were
saw
staffed
at
there.
least 2 residents running
Yeah.
around at all times, and I knew they were residents because
Mhm.
they would come and talk to me about, my labs, or because I had labs drawn all the time because of the heparin. And I don't know. I saw at least 2.
Did you
No,
did
not
you
a
see any
1.
OB patients come through?
Not a 1.
Thank goodness.
Unlike the
EDs,
pit.
yeah, unlike the pit, yeah. So,
Gosh.
and then Suzanne, we
Oh,
witnessed your event.
yeah. I'm still in recovery.
Yeah,
So
because we
we had,
just got back. You
Yeah.
just saw your doctor yesterday or
yeah,
day before.
day before yesterday. So I am so glad to be home. But yeah, I was out of town, out of state, and we had just lectured for 4 hours at a post conference at A1. And really, it was just there were 4 of us, 4 of the faculty members. We were walking out.
With
I was
luggage and everything.
leaving.
We were all headed out. We all
Right.
had our
We were
luggage. Yeah.
headed out. We had checked out of the hotel, everything. Conference was done. And I tripped on a little depressed area in the carpet, where they hide the cords and stuff like that. They kind of pop up. And I fell. And I fractured at the very tip end of my fibula. So a distal fibula fracture, and have pretty extensive tissue trauma on my right leg. And but I had the best team around me. I had I had Stephanie. I had a
People fall
midwife.
out around me,
Yeah.
y'all.
I know. What's new? We had just talked about it.
Yeah.
And you were there. And I fell out. And I had an attorney.
2 attorneys.
2 attorneys. Yeah, 2 attorneys and a midwife. And then they called my son, who had just pulled up at the little circle of the convention area to pick me up. We were headed out. And called him in real quick. And so Stephanie said, okay.
Well, wait, before you get to that,
This is so funny.
Suzanne is traumatized. She's like, something's wrong. I heard a pop, felt a pop, and we heard you go down. Like, well, we saw you go down, but it was an audible, like hands full, tripping, going down onto the knees, painful event. And so you're immediately, trying to move and whatever. I'm like, stop.
Yeah. I wanted to get up off the ground.
And everybody's trying to get her off the ground. I'm like, stop.
I know.
We're not doing anything. Get some ice, get a wheelchair, all the things. But then everybody's literally like grabbing you, trying to help you get up off the floor. And I'm like, nope, stop right here. And then I channeled my Julie Arafay.
You did?
I totally had Julie in my head. And I said, stop, we're going to do a tabletop sim right here. Did I not say that?
Yeah, you did. And I will never forget it. It was, I was so glad you were there, because everybody was there. Like that was my priority. Just get up. And so nobody sees you, but it was only it was only us 4 there. And then,
but a couple of workers came up. So there were like
the
3 or 4
workers were tearing
there.
the room down. Right.
Yeah.
So I was glad that like the participants weren't there. That was like, I looked around to see if anybody else was there, Yeah, broken leg, but traumatized, but make sure nobody saw you fall. But
yeah, so
you did.
I'm like, we're doing a tabletop sim right here. And so I was like, okay, we have a wheelchair right here. She's right there. You're going to grab here. You're going to grab here. I'm going to support here. We're going to count to 3. We're going to do this, because you couldn't put weight on that leg, and your other leg was injured too. And we've got to get you off the floor without injuring any of us and all the things. And I tell you what, everybody stopped and they listened and they did exactly what we decided. And you were off that floor with no problem. And you didn't seem to be, we didn't traumatize you further. Am I correct?
That is very correct. I mean, you took charge too. And that was the thing. So it was, our friend Adam Snyder, who's an attorney, and then Lisa Miller, who's a midwife and an attorney, and Stephanie. And
your son, and Austin.
And my son comes in, Austin. And Lisa has said later, she goes, man, that's Stephanie Martin. I can see why she is so good in a crisis. She said she just took control. She was calm, and then did a tabletop simulation just to figure out how to move you.
I am
It
so
was-
proud.
and I said,
it
Julie'd
just
be so proud.
illustrates the fact that people want to move so fast, so fast, so fast. But sometimes you can do more harm than good to either yourself or the patient if you just don't take just a few minutes. And those leadership skills that you have, Stephanie, are stellar. And I would say Suzanne has the same stellar leadership skills. But those things can be taught. They can be practiced. They can be nurtured. They can be validated,
They absolutely
reinforced
can.
in simulation. And I think it's a perfect example that, people think you got to move fast, 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 fast. And probably had you not done that, it wouldn't have gone as fast because people wouldn't have actually known what to do. And there could have been damage to one of you, further damage to Suzanne. So it's like, it's not a bad thing. I mean, you can't take an hour and decide, but it's not a bad thing to step back, figure out what's the best way to handle it, and then go for it.
Yeah.
Right.
She was just like, time out.
Yeah.
We're going to think about this. We're going to do a kind of a tabletop sim. It was very quick, and they lifted me with ease, which I will say
Yes.
is not easy, I would
Yes.
think.
Well, especially when you can't use your legs. Like
Can't
we
use
couldn't
my
put
legs.
any weight on your legs.
Yeah.
That was the thing. Because we didn't know if it was broken or not, but you definitely couldn't put weight on your left leg, and your right knee was
Yeah.
injured as well. We didn't know what the
Yes.
injury was, so we had to get you up without you weight bearing.
Yeah. And
And there's but I mean, I
Mhm.
think that's the thing, Julie, like you said, there's always time.
Right.
You don't, I mean, you got to get on the chest if somebody's,
Yes.
pulseless, but you have more time than you think. You don't have to rush as much as you think.
Mm-mm.
And that few seconds, it didn't take long to figure out what to do because I established myself as the role of leader.
Yeah.
And
did.
my role of leader was accepted. If it had been challenged with someone else trying to give it conflicting instructions, I would have stopped and had a conversation about who's leading this. I did that the other night. We were at dinner with friends, and I was telling a story, and somebody started interrupting, and I'm like, in a very funny way, it's like, am I telling the story or you? Like, let's just, because if we're both telling the story at the same time, no one's getting the story. You know what I mean? Or learning a game or whatever it happens to be. Like, who wants to tell it? But I mean, not in I'm the boss, I'm telling the story, but it's, what's
it works
the role?
better
Who's doing
with
what?
a leader, particularly
It
when
worked.
you have a lot of very distinct, specific instructions that need to be given. And you, like I said, you have stellar leadership skills, and most stellar leaders will come up with a plan and go, okay, does anyone have any comments? Does anybody see any issues? Do we move forward? Yeah. So you're asking for input.
Well, that's exactly what she did.
Yes.
I think those are the same words.
I mean, I've listened to Julie.
You were listening to her going,
well, I mean,
she was
that's
literally
what I
in my
did.
brain.
That's the thing.
I
Most
know.
people that are excellent leaders, they kind of have a strategy in their head. They are good at verbalizing that. And then they get feedback. Is there anything else I need to know? Does anyone have any issues with what I just said? Because an excellent leader will always listen to input from their team. They always will.
Thanks. Well, my role became clear. Suzanne's role was clear as the patient. Y'all just take a second. What do you think the role of the attorney was?
Well, knowing him, number one, he was most concerned about Suzanne and helping Suzanne. After that, he's going to document every single thing that he sees, because he's like, this is not right. This should not have happened. Yes.
Pictures, videos. He even at one point asked me if I had a quarter, because he wanted a reference for size for the defect in the floor, the visible defect in the floor. And I didn't have a quarter. I had a $20 bill. So I'm like, we laid that on the ground next to the
I didn't know that.
depression. I had my finger in there to show the depth of the depression. So you'd had a relative scale, all the things.
I didn't know that.
You didn't know that? That's
No.
why I kept saying he's got all the pictures if you need them. But so yeah, poor Suzanne broke her freaking leg.
Yeah. But then You call ahead to see you're
Yes.
trying to keep me out of the ED, and you call ahead to a urgent care because I just need an X-ray. That's what
Yeah,
I
I mean,
need.
so the thoughts going through my mind were, first of all,
Yes.
Suzanne's upset, she's
Mhm.
miserable, she's in tears and in pain, significant pain, and she's supposed to be going to the beach. She's literally trying to convince me I'll just go recover at the beach. Just send me to the beach, bypass the ED, all that stuff. And I'm like, you're not going straight to the beach. You'll go to the beach after that. And then we have a conference on a cruise coming up in a month. And I'm like, you're going to be on the cruise. Don't worry. It's going to be okay.
Well, you could see I was already worried that I was going to stick you with like 6 more lectures on the cruise or something. My bottom lip was out and I was kind of snubbing. As my dad would say, you're like, try it up. You looked
Yes,
at me,
I'm
you're
like,
like,
you're going to be on the cruise. You're going to go.
I know what you're worried about already. And I'm like, yeah, I know. I'm going to be there, even if I have to drive one of those little scooters.
Exactly. Exactly. You'll be on a scooter. But I'm literally like thinking, okay, we know healthcare, right? And we also know Julie's recent experience. And I'm like, this is an ankle knee injury. This shouldn't require an emergency. She's got pulses. She can move her toes. There's no obvious nerve injury or anything like that would require it looked like a straightforward orthopedic situation. I thought, okay, this would fit well in an urgent care and not clog up the emergency department. She'd probably wait longer in an emergency department, all the things. So I get on my phone. I look for all the locations. The close ones. I say, we're not going to that healthcare system. We're going to go to this healthcare system. I call them. You heard me call them.
No, yeah. You called them and you said, do you have X-ray
if we get there right now,
there?
if we get there, if we're on our way.
Right. And we're on our way. How long's the wait? And do you have X-ray capability? And they said 30-minute wait. And yes, we do. So
what happened when you got there? So wait, before you get there, I have to comment. Can I just request that either you are never allowed to rent the car again, or when you do, you never rent a Jeep Wrangler again? Okay.
Well, I have 3 boys.
Let me just preface this with the last trip we were on just a few weeks before, she rented a Jeep Wrangler. And I was like, what have you done? Because we had a road trip to make to the airport, like a 2-hour drive to the airport. Jeep Wranglers, okay. They're great cars, not for road trips. Okay. So what does she rent for her road trip to the beach? Another Jeep Wrangler. By the way, Jeep Wranglers are about 10 feet off the ground.
This one was lifted.
It was a lifted Jeep Wrangler. So now we've got to get this injured person with no legs from a wheelchair to the Jeep Wrangler. We did another tabletop sim.
Oh my God.
You did. And I will say the attorney came up with the easiest way to get me in, and that was to get as close to the curb as possible.
Well, not just that. Austin had pulled up where there was a wheelchair ramp.
Yeah.
Okay. And I'm like, no. We want the curb. We need the extra height of the curb. So move. And then it became a whole thing. So anyway, we get her in the Jeep. She goes, and so what happens when you go to the urgent care?
So I hop in because I don't have a wheelchair anymore. That was the hotels. I have no crutches, nothing. And I am hanging on to Austin as best I can with hopping on my tissue trauma leg and get in there. And they just looked at me. The 2 people at the desk, they just looked at me and and this woman wasn't going to get up. And I hop over to the thing to check in. She wouldn't get out of her chair. And so I am leaning over to give her my insurance card, my driver's license, and I finally just said, I need a wheelchair. I can't stand here anymore because it was cramping up in my leg and my foot and the other leg. Anyway, so she rolled her eyes at me and took a big sigh and got up from her chair and went and got me a wheelchair.
Oh my
and
gosh.
You are
walked
such an
in it.
inconvenience.
I
Suzanne.
was. That's what I felt like. I felt like I was inconvenient to her. And it wasn't that busy there. There were a lot of pediatric patients because
you're at Disneyland.
I'm in
Disney World.
Yeah. And so there were a lot of kids in there, coughing and So I'm like, take me over there. So I get my wheelchair. But we waited for about an hour until I saw a nurse practitioner who then said, well, it looks like a sprain. It's probably a sprain, that she pulled this knee thing up my leg and a support kind of thing on my other leg. And I got to tell y'all, my broken leg was burning. That's the kind of pain it was, and it was swelling and everything. They never offered me ice, ever.
It looked like a basketball.
I know. They never offered me ice. They never offered me anything. And she goes, but our x-ray tech is not here.
That's the best part.
Not here. We don't have x-ray capabilities today. So you're going to need to go to another location to have your leg x-rayed.
After
you'd called.
So this is the thing that we are savvy compared to the average consumer, right? So I anticipated this. I anticipated that they might not have x-ray capabilities, that there might be we had several choices of places to send you. And when I got the right answers, I'm not going to call 10, right? And say, who's got a shorter wait? It's like,
right.
You can be there by then, right? So pick it and go. Just tell me, no, we don't have x-ray.
It's outside of your scope.
This is ridiculous.
Or we usually do, but today we do not. And you'll need to go to this location. That's all they had to say on the telephone, because it wasn't like you looked it up and on the web or anything to say you could get x-rays there. You talked to somebody at the front desk.
Probably the girl who was
rolled her eyes at me. Yeah. It was so inconvenient that I had to have a wheelchair. So we had to leave. So now it's like an hour and a half in. And so we go over to the other walk-in clinic. And again, I hop up there. I have nothing. And I hop up there. And again, my other leg that's has tissue trauma is like cramping. And I just walked to the front door and I go, I need a wheelchair now.
Well, you were in pain. You've crawled in and out of a vehicle
really
with a broken leg and a traumatized leg. Now, how many times? 1, 2, 3, 4.
Yeah, now I've 2. Yeah.
Yes.
And they were
you had to get in and out of that Jeep.
Easy task.
Yeah.
Each time. That's ridiculous.
Yeah. So anyway, I got in and I got my x-ray and I told the girl, I said, the x-ray tech, I said, I don't know what to do. I don't have a hotel. I was headed out of town. Do you think I should? Or do you think I should wait around and figure out what's in my x-ray? Or, I know you're not supposed to read them, but if you can just give me a hint, and again, that's me being in healthcare, knowing what to say,
Yeah.
And a lot of times they'll just say, no, I can't. But this x-ray tech said, I saw something on the left ankle. Yeah. Okay. Thank you. Gave me a hit. So she said, go back over to the other.
That you can't walk into.
Walk-in clinic. Go over there. Yeah. And you should hear something within the hour. So I did. And we sat there. I didn't go in because I was waiting for them to call me. They were supposed to call me. So we went across the street and got some pillows because I'm already planning my road trip. So Austin went in and got 2 pillows for me to prop my leg up in the back seat for my travel. I was getting out of there is where I was. I was planning my escape. And we go back over to the clinic and I said, I need to know what to do. And they told Austin he went in there instead of me having to get in and out. And they said, you won't know anything until in the morning.
This is the stuff that is infuriating because this is very simple. This is not complicated. You can have processes, you can communicate. So in contrast to Julie, you were surrounded by chaos, but you knew what was happening with you. You got timely communication. Your expectations were set and you got decent care. You got completely the opposite, Suzanne.
Yeah, I know. And I ended up calling him back and I just got on my phone because I wasn't going to hop in there again and get turned away.
I love you're calling from the parking lot.
I'm calling from the parking lot. I really was.
Good. That's smart.
And I said, listen.
You don't need to be bungee jumping out of that Jeep Wrangler.
No, for a 5th time. I just said, listen, I got to have somebody read that x-ray. They're like, hang on. And so I got to a nurse. She's like, hang on. And she asked the nurse practitioner to read the x-ray and then said, yes, it's fractured. Um, and come on back in. Can you come back in? I go, well, actually, I'm in the parking lot. So I hopped in again and got the wheelchair again and went back
But
to
I think
the
even before
same room.
that, Suzanne, you had sent me your images.
Yeah.
And I was
it,
like, and I'm
yeah.
like, it's fractured, Suzanne.
I
And
know.
I'm not an orthopod or a
Yeah.
radiologist.
I was like, put them on my chart and I'm going to go into the system and read the damn things myself. I can see that much, you know. I can
No,
see where my fracture is. And again,
here's the funniest part. She's like, oh, the good news is that on Epic, I'll be able to go into my account and look at my records. I'm like, when you've used Epic once, you've used Epic once. Like that, it's like
it's the best thing about Epic.
It doesn't mean you have. I mean, but there's a whole rigmarole you have to go through to make them linked. But you did ultimately get them linked. But
I did ultimately get them linked.
But you actually thought that just because they both had Epic, that you were automatically in your system.
Yeah, I wasn't. But at least I got it read.
Yeah.
And then they put the dumbest splint I've ever seen on my leg. I kid you not. This thing was terrible. And but it protected
I have
it.
to lighten up the moment here for a minute.
Now, there you go. Peanut butter.
He's like, I will.
Peanut butter. Are you
twitch an ear?
comfortable?
Oh,
Say
there
hi
he
to the
is.
people.
He is. That's so cute.
Yeah, sweet baby.
So, I'll live, as my dad would say.
Well, I'm just glad you got treated. You got evaluated. You don't have to have surgery.
Yeah, that was.
So are
I'm
you
so
booted?
thankful. I am booted. I am. So I have. I see my orthopedist regularly anyway because I have arthritis in the traumatized leg, not the broken one, but the other one. And so I told him, I said, okay, I am going to irradiate. I'm going to need one of those radiology clips that says how much radiation I've been exposed to if I get any more x-rays anytime soon. But I was so glad to see him because I know the system, and the system is so amazing at Vanderbilt. I almost get emotional talking about it because
yes.
The people.
It's a sense of relief.
It is, and
You have a medical home.
But the people are so kind and caring, and I could get right in to see him, and they were.
No one rolled their eyes at you?
Nobody rolled their eyes at me, and I have confidence in them, okay? And I think that from a patient perspective, and what Julie went through too, patients need to feel confidence in their care providers, and I think just the communication and the act of caring, even though you knew they were busy, and God, Vanderbilt's always busy too, and this clinic is ginormous.
Yes.
But it's the attitude that people have, and it's so important to treat patients that way, that they matter, and that no matter who they are, that they matter, and that and the plan.
Yeah, I mean, the thing is, even if you're overworked, underpaid, or whatever, there's a difference between being dismissive and rude and inconsiderate and just not going above and beyond, right?
Yeah.
Like you can be tired and not be rude, and you can be exhausted and not be dismissive, right? Like we've all been in that situation. And, I saw somebody on social media talking about this, how, in healthcare, she was talking from the perspective of a physician, but it applies to all of us in healthcare that, we're really expected to be customer service and the expert and the problem solver and all the things. And sometimes you just can't do it all. And so my default bare minimum is going to be make sure I do good medicine first. And I may be abrupt. I may be direct. I may not couch it in the most soft, whatever way, but that's different than dismissive.
I do. I do.
Yeah.
I
In
never
my opinion. And
felt
do y'all
that
agree?
I
Yeah.
was not paid attention to, or that if I needed something, I didn't get it, even in all of that chaos. And I think that speaks volumes to the culture in that institution. And much like Suzanne, my home institution in my hometown
Mhm.
was fantastic. I mean, I have never had any issues with any of the care. I have been treated with respect, with very professional healthcare providers. I mean, I just feel like I have landed into a little bit of nirvana here. It's been fantastic. And when you find that, my
Yeah.
God, when you find that, you're like,
My
oh, I'm
experience
not
there was the
moving.
same.
Don't care what the heck
Mhm.
happens. Anywhere else, I found good health
Mhm.
care.
No, it's
Yeah.
true.
But I know I just found it as really
Yeah.
as a challenge to anybody who is taking care of patients to not be that dismissive or roll your eyes, or I don't care if
Yeah.
they're what people
Mhm.
call frequent
Yeah.
flyers, which I hate that but I've used it too myself. Earlier in my career, I will admit I used that term, and the more mature I became and the more I learned that it's usually
Yeah.
those patients, they usually, I
Yeah.
mean, they can have really bad outcomes. Something's going on, right, with them, but not to be dismissive of anybody, but to really just keep them informed and communicate with kindness, with you know, compassion. That's why we went into healthcare. And if your system doesn't support that, doing that, or if you can't do that, the system either needs to change or you need to get out of healthcare if you can't be exhibit those behaviors, right? We're not talking about a crisis. I had a fractured leg. I have tissue trauma. That is not as
Yeah.
crazy as like some people in an emergency department, things that they're going through. But it was just it was something little that they could have fixed by communication and by just showing some compassion. They literally threw me some crutches and said, "Here." And I haven't used crutches. I can't even remember using crutches. Maybe in the 80s or something.
Do you think in hindsight now, knowing what you know about your experience and your leg and your injury and all the things, um, do you think you should have gone to an emergency department? In hindsight, would you go to an ED instead?
Yeah, I would have. Only because they would have had
Everything.
everything that I
Mhm.
needed to make a diagnosis and get a plan, and I could
Yeah.
have been I would have well, I don't know if it would have been longer or not.
Yeah.
Um,
'Cause you
might
would
have
have been
had to
low on the totem pole, so it could have
I
been
know,
random how long I
right.
mean, you might have had
Depending
no wait, you might have had a day wait.
exactly, depending
Mhm.
on the ED, really, I
Mhm.
think is
Mhm.
probably it now. I wouldn't have gone to a trauma center or something like that.
Mhm.
So, hindsight now, but
Mhm.
I mean, literally, you were correct that they should have been able to handle this. I mean, my fracture is not displaced, so I do not have to have surgery. So
Yeah.
even if I needed surgery, they weren't going to do it there. I
Right.
wasn't going to let
You
them
just
do it
needed
there.
you needed some immediate care, a diagnosis,
It's
and
something for
that's it, so
pain.
that
Yeah,
you could
splinted,
yeah.
casted, whatever.
Mhm. Yeah, the immediate support. Yeah.
They gave
I
me
mean,
nothing for pain. Nothing. Offered nothing. I have an anti-inflammatory for my knee that I take on occasion, so I took that and
at
I
least
took
they could have
Tylenol.
asked, you
That's all
Interesting.
I've
know,
had.
and given
So
you, you know, after
no,
my surgery, I
didn't
got like
offer.
5 tablets, and the surgeon said, "I don't think you're gonna need them, but you've got 5. Don't take them unless you have to have them." And I ended up taking 2 and, through the rest,
Yeah.
disposed of them appropriately. But
Yeah. Yeah, thankfully, I was able to manage my pain with the alternating um it's a once a day, pill, but, taking Tylenol on top of it. Main thing is just burning, but the problem is with the cast that they, put me in, I, couldn't ice it.
Of course you did.
So I deconstructed it.
Of course you did.
I deconstructed
Suzanne is the MacGyver.
I took it apart.
Yes. Because if there's a rule, Suzanne's going to find a way to break it.
I am going to find it. I'm going to break it. But I did. I got out of it. And so if I was just laying there, it wasn't on. I had ice on my, because it helps with the pain too, right? And I was like, okay, this is not right. I should be having ice on it. Rice, remember, elevate that thing and compress it. And so I just did my own thing, and then I got back to my doctor. And he was like, you're right.
I'm glad you're back in one piece, both of you. And I'm very grateful that I have no recent emergency department stories to share with anyone.
You better behave.
Hopefully I do not have any to come. So we're putting that out in the universe that Stephanie is not going to be going to any needing hospital care at all. Okay. But I think that's a wrap for today. But we are going to go right on to our next recording, and we're going to be working on our next Patreon episode, which is reviewing the episode of The Pit where there's the shoulder dystocia. You guys made it loud and clear you wanted to hear us do it, but we're going to do it on Patreon, patreon.com/CCOB. I got notes, folks. I got pages and pages of notes. I had to stop it multiple times. I wanted to poke my eyes out a few times. We got thoughts about what they did right, what they did wrong, how to prep for this. We've got an offer for HBO Max for our services, since they don't seem to understand that there are actual experts out there that do this for a living that could give them advice. No.
I think Noah Wiley would listen to us too. I think.
Okay, well, we'll tag Noah Wiley in this.
We do. Because, he was on Capitol Hill advocating for healthcare providers, clinicians, nurses, and docs. And I'm really proud of him. And so I love The Pit. I love watching it. So Stephanie can't watch it because it's too traumatizing.
I had to fast forward through the non-obese stuff. It's just so, like the nurse that got hit in the face and won't go home.
Yeah.
The resident who had a miscarriage and is now dealing with this delivery and won't go home. Like, I'm just like, because I see myself in them, right? Like that was me earlier on. So it is just like trauma. And I want to run.
But you learn to love the characters and their character development. So you just love them and what they do. They talk about showing compassion. So many of them.
Well, it does make me like nostalgic for my residency days, because residency and fellowship was so amazing. Like, I loved being a resident and fellow. I loved learning. I loved all the things about it. And it was all, it's a trauma bond, right? Like, some of the people that are closest in my life are from that time. Like, I still speak to my co-residents and co-fellows. And I love them. And of course we're bonded and I have great memories of it. But there's also some time, like the 110-hour work weeks, the no sleep, the, making mistakes because you're too tired, having no help when people are dying around you. That's all still very real.
Yeah. So it's a great show, but we'll talk more about it.
Yeah. Okay, guys, thanks for listening. Meet y'all on the other side.